When we opened almost 3 years ago, it was a great asset to have a comprehensive wound center out here in St. Charles County. We call it a comprehensive wound center, which would include many different types of treatments, from medicine to topical treatments to debridements to hyperbaric oxygen, with multiple physicians working here to consolidate and kind of work on the care together.
We're very unique in the way that we do wound care. The premise of what we do is we find the underlying cause of the wound. If we can help fix that underlying cause, then we can help those wounds heal faster.
Sometimes they are needing further additional treatment, which could be a skin graft in the hospital, which is surgical. And we have several physicians that are different specialties, which then offer infectious disease coverage, orthopedic coverage, and just general medical coverage along with the wound care. Hyperbaric oxygen, we kind of consider an additional medicine we can use in certain types of patients and certain types of wounds.
When you're in the chamber, the oxygen is much more prevalent, and that pressure forces it into your body. You're breathing it in, and it's also just being forced into your tissues. So it's creating microcapillaries, down in your feet and in the tips of your fingers and places that it can't get to normally, the blood can't get to normally, and then it's increasing the oxygen in your blood. So that wound that is what we call hypoxic or low on oxygen is getting more oxygen than normal, so it's being able to heal. So when we stack those treatments on top of each other Monday through Friday, we're just continuously, adding to the healing process.
The comprehensive wound center we have here, I feel, has a great team, and that includes the physicians we have working here. We have a great panel of physicians, and everyone gets along wonderfully. There's many a times we'll have patients in the rooms and we're laughing over something silly that someone's brought up, and the patients see that. They see how much fun we're having at work, despite them having a sometimes very negative attitude about this chronic wound. We try to uplift them, and part of that is people have been happy and pleasant and wonderful. They're so excited to see these patients, I think, which makes coming in to deal with debridement and a wound much, much easier.
It just helps you with your own attitude, how you go about taking care of yourself with their positive attitude, with all the people here and everything. What a great attitude everybody has. Very personable. They allayed any apprehensions I had, told me what the treatment was going to be, how the treatment was going to work.
Progress West is a smaller community hospital within the BJC system, and we are supported by the system as a whole. We will receive referrals from downtown sometimes, down from Barnes-Jewish Hospital. If patients are visiting their clinic there, but they work in this area or they live in this area, they'll refer them to us so that their appointments are more convenient.
I know there's a large population out there that may not have known there was such a wound center here. We have great physicians and opportunities and things we can do here at the wound center that patients don't have to cross the river. I know in a lot of our older patients that's a big deal, is to cross the river, and driving, they may not have transportation. So the close proximity we are to St. Charles County and even further out, I think, has been a benefit to those patients.